Hello everyone, this is Mia Taormina. I'm one of the infectious disease specialists here at Duly Health and Care, and I'm the co-chair of our department, so I oversee a lot of what's going around. Okay, so right now we're experiencing across the country and pretty significantly in the Midwest a concentration of cyclospora cases or cyclosporiasis, which is a condition that causes infectious diarrhea, and this can be pretty long-lasting, pretty significant, that can impact your life in a lot of unfavorable ways. So we're hearing a lot about this in the news currently, and we've got at this point 161 confirmed cases in Illinois at the time of this recording, but many cases around us. Michigan, for example, has well over 1,000. So there are pockets of infection that are pretty substantial, which is unusual for the typical number of cases we may see. So cyclospora is actually a parasitic infection, and it is spread by what we call the fecal-oral route, meaning that you've consumed something that's contaminated, usually food or water. So, of course, then it would be best mitigated by good hand washing, making sure your produce especially is properly washed and food is properly cooked. In an unusual way, it's not highly contagious person to person, because once this parasite is shed in the stool, it actually takes a week to 2 to become infective. So it's going to be a more chronic exposure, and that stool potentially contaminating surfaces or contaminating food products, water products that ultimately end up being consumed. So that's where the greater concern is. If you were to become exposed to cyclospora, generally what happens within about a week of exposure, there could be significant watery diarrhea. I know in the news they've talked about explosive diarrhea, and it definitely can be more urgent presenting. You can have abdominal pain, cramping. In some cases, this does go away over time, but can wax and wane, where you'll have a period of symptoms getting better and then worse again. The total course is generally a few weeks, but it can last much longer. For most people that don't have antibiotic allergies, this is actually a parasite that responds well to certain antibiotics like Bactrim. If you have a sulfa allergy or have other immune suppression or renal disease, you may need to speak with your doctor further. If you are immune suppressed, you also may need a more prolonged course of treatment or potentially even an alternative course of treatment. But in general, this is something that we do see every year. We just have more cases currently, which is why we are on high alert. If you have suspected diarrheal illness and something is not improving and is causing you significant watery diarrhea, or if you have family members that may have been experiencing the same thing after eating at a common location or drinking water from a common source, the testing is done at your doctor's office through what we call a stool PCR test, where we take a sample of stool and send it actually for genetic level testing to see for the presence of this organism. And then you can discuss with your doctor or provider applicable treatments in your case. So if you have any concerns about some of the symptoms you're experiencing and are wondering if they may be due to something like cyclospora, the first step would be to call your primary care doctor to discuss appropriate testing. Should your doctor have any questions or concerns, if you have a positive result, positive testing can certainly be weighed in by us infectious disease specialists here at Duly Health and Care.